Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Dr. Roshani Sanghani is an American board certified endocrinologist who brings 15 years of clinical experience to the table alongside her own personal journey as a patient of hypothyroidism and prediabetes. Her personal touch allows her a deep understanding of the struggles many patients face, including medication side effects and escalating doses. Her philosophy is that the true magic pill is lifestyle change, and her medical journey is as layered as her approach to healthcare. Her career took a transformative turn when Dr. Sanghani became a certified diabetes educator in the United States, subsequently launching culturally relevant diabetes education classes in Mumbai, India. Dr. Sanghani is the author of the amazing book, Turnaround Diabetes, the step-by-step guide to navigate type 2 and type 1 diabetes with less medication. One of Dr. Sanghani's key strategies is addressing the nutritional imbalances that many patients face, particularly in India, where vegetarianism is culturally prevalent. To tackle this and other chronic conditions more effectively, she shifted from one-off doctor visits to a model of ongoing 3 to 6 month coaching programs, including taking the Society of Medical Health Practitioners training to help serve her patients. Dr. Roshani Sanghani, what an honor it is to welcome you to Boundless Body Radio.
Thank you, Casey, for having me and making this happen.
It's such an honor to host you. You did such an amazing presentation, which I definitely want to talk about at the Symposium for Metabolic Health, which is absolutely fabulous. You're calling in from Mumbai, India right now, which is completely the opposite time zone as us. So I appreciate that it's very late at night and you're in the middle of a thunderstorm in Mumbai. You were just explaining how crazy the weather can get there. I remember a few years ago, I was watching Netflix and a recommended show came up and it was all about cricket and it was all about the Mumbai Indians cricket team. And I knew nothing about cricket, but I got way into the series and I actually have a Mumbai Indians cricket jersey, which I wear from time to time. So I am supporting you from literally halfway across the planet.
I have one of those t-shirts too.
Nice. That's awesome. What a fun sport. It looks awesome. I would love to go to a game there.
Yeah, I think next with football, it's probably got the most followers around the world.
Yeah, seriously, it's amazing. India culture to me is so interesting and so utterly complicated. I've got a few clients who are from India and them trying to explain like how all the states are so different, the languages are different. Like there's so many different and layered things about India. It must be just a fascinating culture to be a part of.
Yeah, I mean, it's been a re-education and reorientation for me that happened in 2011. And that was the big reason why I did the diabetes educator course when I came back, because I was practicing as an endocrinologist in the States and I would leave the prescription of education with my educators. So I would write the medications and my educators, nutritionists, dietitians, coaches, they would teach the patients what to do with their lifestyle. And I wanted to have that knowledge in my hands so that when I came to India, I could do these talks and conversations besides just writing medicine. And that way I would learn what's going on in their homes, in their lives, in their daily decisions. And that was, I think, what saved me as a doctor to do that.
Wow. Yeah, that's fantastic. I do want to talk about your personal story, and I do want to capture some of the key points that you made in your presentation in San Diego, which I thought was fabulous. Before we do, I've been asking everybody who has been on the show what some of their highlights was from the conference. And I just have to tell you, the number one highlight that everybody has talked about so far was the day that was all about mental health. And that theme carried on throughout the entire conference, which I thought was absolutely amazing. But I also have to say, for all the people that we've had on and interviewed, and I've asked that question, what has been a standout to you? That one of the things I've heard absolutely the most is your presentation. You did such an amazing job, and it was different. It was like a different kind of a theme than some of the other presentations. So that stood out for a lot of people. So first of all, I just wanted to say thank you and let you know that that made a big impact in a room of people that then went out to try to make a better impact in their world. So I hope you're very proud of what you did because it was really special and different. And I think you made a difference in a lot of people's lives that day. So first of all, thank you. And second of all, what were some of the highlights that stood out to you about that conference?
Thank you, Casey. You know, you said it and it sort of made my eyes sting with almost tears of gratitude because I was nervous coming there. It was my first time meeting all of you from far away. You know, I've been in India since 2011. My metabolic health and lifestyle awakening and low carb maybe happened in 2013, but I was still alone in that way that I hadn't met colleagues or healthcare professionals who were doing this similar to I was. I think globally, when I look at that time window in the whole world, we were all waking up in our own ways about a decade ago. Many, you know, there are some pioneers who've been doing it for longer than a decade. But for me, everybody was far away. I couldn't really meet them. And San Diego, for me, my personal highlight was to meet everybody and to be in the same room with everybody and in the flesh. You know, I've been like this work from home, remote, it's like on steroids. I've been so far away from that community that met in that hall for those 4 days. And I found friends, I found colleagues, like-minded, kindred spirits who saw what I was doing and, you know, celebrated what I was doing. I mean, in India, patients definitely appreciate what I'm doing. More and more, there are professionals who are beginning to understand and, you know, get on to this way of thinking. But I'd still say it's fairly lonely. I can probably count on my fingertips how many colleagues have like wholeheartedly, openly come out and embrace this as their way of practice. So to have a whole conference hall full, 4 days full of symposium, full of people who are doing this as their every day, they've let go of the mainstream. It was really nice to be sort of surrounded in that. And from there, all these follow-up conversations with like today with you and just so many relationships that I look forward to nurturing.
Yeah, well, that's amazing. I've been in this world like you for a while, and I followed a bunch of people, and I was unaware of you and your work. And so I think that is, to say like all of my free time for years and years and years trying to study this stuff, and I hadn't come across your work. That does go to show that there's so many people out there that do feel, like you said, like lonely, like we're working in isolation. And once you get in this room, again, you're with all of these people that are supporting you and on board and in different levels of their own health journey. And I've argued the point that like we could be talking about anything. We could be in there talking about different paint colors or cricket teams or whatever. But when you get a room of people together that are all in the world of ketosis and are ketogenic, if nothing else, just the energy level of that room is the vibe alone. Just the vibe is incredible.
Yeah, and this passion amongst each person there, whether it was someone whose own health had been transformed and they were a member of the public, or they were from healthcare and they had flipped around and said, no, I'm going to come and do healthcare this way. There was that passion to make the world a better place and to give back, and the sense of urgency and commitment that we have together as a tribe is, oh my God, there are so many lives that are still suffering. And if we've tasted this benefit, we really want to do what we can to break barriers and get this out there and just spread it and multiply it, because
Yep.
it would really reduce people's suffering.
Yeah, it's amazing. What stands out, especially with your presentation, was some of the amazing questions that got asked. Classically, Doug Reynolds is on point when it comes to the questions that are asked. But to have Dave Feldman and Dr. Tony Hampton and Dr. Karen Zinn all come to the microphone and ask you questions, and that also stood out to me about you. You had amazing questions for some of the other presenters as well, and you realized that even though like you're one of the smartest people in the world about this topic, there's still room to like learn and grow and learn from other people. And some of the questions that you asked throughout that conference were fantastic. So I have to give you credit for that as well.
Thank you. I mean, and sometimes people tune out in the question answer session. Like if it's not my question, I'm not listening. So I'm amazed that you were listening to all the questions and, you know, paying attention, because we learn from other people's doubts too.
Yeah, no, it's hugely important. If nothing else, we would have bonded over. I believe you're wearing a pair of Vivo Barefoots, so we would have bonded over some minimalist footwear as well, which is awesome to see a disproportionate number of people in conferences like that wearing minimal footwear, which is awesome. Yeah, I absolutely love that. That's fantastic. Okay, so before we dive into some of the content today, like I said, I was not as familiar with you and your content or your story. So tell us about your own personal story about having an interest in the medical field and how you eventually got into metabolic health.
Sure. So I had been always interested in mind and body and the influence of thought on health. And I actually did a year of psychiatry before moving back into internal medicine. So I was that interested in the power of the mind. And I'm glad that I came to internal medicine. I loved the psychiatry year. It was so fascinating. But I decided to come hands-on into internal medicine and be nitty-gritty in the core details of how the internal, body works in terms of internal medicine, and then specialize in endocrinology. It was a natural fit for me to be a hormone specialist, because thoughts cause feelings, feelings cause habits, habits cause changes in the body, or thoughts cause feelings, feelings cause hormonal responses in the body. So either way, whether it's through habits or emotional experiences of life, the hormones are responding to everything and making sure the body is responding to this external world. So it was so fascinating. And then diabetes just became all of that, it's so much about behavior. It's also skilled for my side to be good at internal medicine, because diabetes can affect the entire body. So you have to be good at the medical part. And you also have to be good at understanding medications and the complexity of the condition itself. But you have to also deal with the complexity of what's this person going to do when they leave the room. So it became a natural fit for me as endocrinology. But I didn't realize through training how I was getting blinders put on. And I just finished reading Gary Taubes's book that came out earlier this year, Rethinking Diabetes. And it's been amazing, almost sad to know that even 70 years ago, there were low carb and ketogenic proponents, talking about this. Before insulin was discovered, there was the discussion about low carb, high fat diets. And it somehow just never made it mainstream, and all these sort of where it just got suppressed. And so similarly, I was also with blinders on, and it's sad, I'm watching Gary's book take us through waves and waves of physicians whose voice was tried and suppressed and tried and suppressed. And in the later chapters of the book, it says, in 2009, somebody's written this, and I'm going to get the original article, where they said endocrinologists, before insulin was discovered, were the only ones who, they couldn't see the hormone that was the problem. They had to look at glucose. So if I say a hormone doctor has to deal with like cortisol, the stress hormone, and you can measure cortisol, and then you'll say, oh, this is a condition of too much cortisol or too little cortisol, or thyroid hormone, too much thyroid hormone, too little thyroid hormone. And what he said was, diabetes is the only endocrine condition where we're not making the diagnosis based on too little or too much of the hormone. We're making the diagnosis based on too much sugar. And the diabetologists were focused on sugar, but the endocrinologists still hadn't made the move that diabetes is an insulin problem, either too much insulin, hyperinsulinemia, type 2 diabetes, insulin resistance, or too little insulin, type 1 diabetes, or beta cell failure. And so that was like, oh my God, I was one of those endocrinologists who was looking at diabetes as a glucose problem, not an insulin problem, even though I was trained that way. It just felt bad. And that wake up call for me happened in 2013. And I start my book with his story of, although I knew about nutrition and I knew about carbohydrate counting for type 1 diabetes, it was just staying over there. It wasn't coming into the type 2 space. It wasn't coming into the weight management space that, oh, if you take more carbs, you need more insulin. I knew that in type 1 diabetes management, but it never came into the other areas until this patient said, I'm not going on insulin. And when he said that, I had to actually do the lifestyle part. And that's when my transformation started.
Wow, that's interesting. What about your own personal health? We mentioned in the introduction that you had a bit of a journey with your own personal health. How did that evolve?
Oh, okay. So again, 2011, we moved from the US to India. And from my genre and my husband's genre of professionals, we are amongst the rare ones who, did our undergraduate training in India, did our higher education, our master's, almost double master's in the United States, and then worked there, and then actually did another international move to come back to India. That was a rare phenomenon. It's still kind of rare. Most people leave and then they emigrate and they stay. So we were a bit alone professionally here, both of us. And I think even personally, the adjustment was tough. I mean, I have no regrets, but there was definitely more than we had expected to be dealing with. And it was a very stressful time. Change can be stressful, good stress, bad stress. And so that stress started to really take a toll on my physical health. I was not low carb by this point. I was still eating the traditional vegetarian, Indian, home cooked meals, which were carbohydrate predominant, definitely protein deficient, but I wasn't aware of that angle. And I had been eating that way my whole life. the thing that changed was I had a big spike in stress, and I ended up with pre-diabetes. I had been already dealing with Hashimoto's, and I was hypothyroid, so I was taking thyroid medication for about, I would say, 6 or 7 years by then. And my mental health was just getting really out of hand, and I had like almost like a spiritual breakdown. And it was at that point that, I'm going to be fully honest here, is I had a friend who said, you're ready to learn some spiritual classes now. And so I was like, I'll do anything. I'm so unhappy. I'm tired of being unhappy, and I just want to be happy. So if that means I need to change the way I'm thinking, I'll do it. And I wasn't realizing at the time that this was going to be my mind body journey. I was just trying to get out of my, crazy spot in my head. And that was Reiki. That was the spiritual class that I took. And I think that's what really made a big difference in me coming out of needing medications. I did not ever have to start anything for prediabetes. It's been 10, 11 years now. My HbA1c at that point, the max was 6.3. Normal should be below 5.7. And nowadays my HbA1c sits at like a 4.9 or a 5.0, and I'm still
That's great.
vegetarian.
Yeah, that's
And
amazing.
and I'm off thyroid medications too.
Wow. Okay. Well, we've already had Dr. Adrian Sotomoda come on the show, and we established scientifically this is objective, not up for debate, that Mexican food is the best cuisine on the planet. You might disagree. Indian food is amazing also, but it is very challenging. Like, I look at some of my clients who are from India, and they're making traditional Indian food, and it's very difficult to try to help them with metabolic issues, but they're, I don't know, it's tough. It's not just like, I can't just tell them like, oh, eat more protein and don't have any carbohydrates, or eat lower carbohydrates. It's very, very difficult with some of those limitations with the cuisine. So how difficult was that for you to make some of those transitions?
Oh, yeah. So first of all, I had to see the science of it and see the insanity of what I was doing with my own food. I just hadn't ever done the math. And as I started reading, Gary Taubes, Robert Lustig, David Ludwig, I was reading Always Hungry, Fat Chance, Good Calories, Bad Calories. I was now devouring everything I could find in that space. And YouTube was picking up at that point. So I was beginning to like consume things on the internet that way. And Jason Fung's books came in my life as well. So all of this stuff was showing me carbohydrates, and I'm looking at the Indian diet and I'm like, it's all carbohydrates. It's all processed powdered carbohydrates. It's not even whole grain anymore. And they think it's home cooked, so it should be good. They think it's vegetarian, so it should be good. And or they think it's a balanced plate. And you know what, Casey, I've been convinced initially about the plate method. I used to give my patients a picture of the plate with like half of it vegetables. I wouldn't do half of it grains, but I would do half of it vegetables, 1/4 carbs, and 1/4 of protein. But even then, I wasn't making them count. And when I started counting the average Indian vegetarian meals and started to do their macros, I realized the average Indian that I'm seeing is getting no more than 15 to 20 grams of protein per day.
Yes.
And they're
Oh my
already low
goodness.
fat, right? They're already scared about low fat and all the saturated fat, and they're doing all that. So they are eating mostly carbs. And how many grams? We're looking at 250 to 300 grams plus per day, every day.
Wow. Yeah, that's crazy. So, okay, so I've been following a carnivore diet for over 5.5 years at this point. So for me, protein intake is not, huge concern. For you as a vegetarian, you said you're following a vegetarian diet. How are you able to get enough protein, and how should I help coach people who want to follow a vegetarian diet to be able to get more protein?
Yes. So if you remember how I went about this in San Diego, it was kind of like meeting people where they are. I could tell them that you're at 250 grams of carb a day. Low carb is 80 to 100 or below. I mean, ketosis is 50 and below. But honestly, for it to be sustainable as they can do this for the rest of their life, I have not seen someone vegetarian be able to stay below 50. It's just been practically, especially if you're trying to get whole food and not just be on protein shakes all day long.
Right.
So the way I have offset that is by adding intermittent fasting at a later stage once I get their protein optimized. But what I do is, instead of throwing them this perfectionistic prescription of oh, it's day one, you're at 250 grams of carbs. I need you to make that 100 grams tomorrow. No, first of all, someone who's eating high carb, they're hungry all day. They are eating food all day. They're looking for food all day. There's small, frequent meals. There's snacking. There's cravings because the high carb, high insulin, they're gaining weight, they're eating. So telling them to just cut their food down makes them nervous. So what I had to do was go the other way is, oh, you're having symptoms of weakness, no muscle gains, hair fall, poor wound healing, poor skin quality, indigestion, gut issues, and you're very protein, bad immunity, repeated infections, non-healing injuries, all of this, I can point to protein deficiency as a big connection. So why don't we give you more protein to cover these symptoms and divide your protein across your 3 meals? So start from the symptoms that they care about, because they don't really come in saying, oh, help me reduce my 250 carbs. They're saying, help me with my symptoms. So if I show them your protein deficiency is linked with your symptoms, how about we increase your protein? And then what I do is I do a food recall with them, and they have to use my app. If they're working with me over 3 to 6 months, they have to log their food into my app, where I've built it myself with my husband and my team. And we have all the Indian foods that people from north, south, east, west, all the Indian cultures, we've got it all in there so they can find their macros. And I want them to be able to log it in there and see how we're gradually going up on their protein counts.
Gotcha. Yeah, that's really good. I love that. You mentioned intermittent fasting. I don't know if this has fully been studied. It's just something that I've observed. So I'm really curious to hear what you think. In my mind, I have a specific protein recommendation that I would recommend for most people. And again, I think most people are falling like way, way, way short of that. However, when somebody does some type of intermittent fasting, time restricted eating, maybe they're only eating 1 meal or 2 meals a day, what I observe is that they may not be reaching that protein goal. However, when I'm measuring their body fat and I'm measuring their lean mass, they don't lose lean mass. They maintain lean mass on a much lower protein intake. So first of all, is that something that you've observed? And secondly, if you know the answer, great. But would you speculate, if this hasn't been studied, would you speculate that maybe the autophagy part of intermittent fasting is helping us preserve protein so that our intake we can get by with much less?
Right. So I guess I have to first get one more piece of information from the people you're seeing do it on your end is, are they taking the ketogenic type of foods or carnivore-based foods and then fasting?
Yeah, mostly eating fats and proteins, mostly
Exactly.
kind of animal fats and proteins for the most part. And
Exactly.
again, like the number isn't what I would want it to be. However, they don't lose lean mass.
Yes. So I think in your case, the answer is yes, you're right, that you will see protein sparing effect. There are studies showing that ketosis or being in fat burn ends up after a few weeks, or actually after a few days of being in that ketosis, is protein sparing. So you would be burning the fat, but you've achieved the ketosis through nutrition ketosis. So your fasting durations are shorter, but you're entering those fasts already in the ketotic state. So you don't need those super long windows. And the reason you're probably not seeing muscle loss or lean loss is because your autophagy is on. I don't know if they're doing water fasts or are they doing bone broth or something. What kind of
Yeah,
fast?
across the board. I mean, it's different for everybody, but just even
Yeah.
people eating like once or twice a day kind of a thing.
Right. So again, the autophagy is supposed to be, again, this is me reading about it, is shut down when you get any form of protein in. So even a fasting fluid that has some bone broth or collagen or something in there, it's likely to shut down your autophagy, because that little bit of protein will stimulate mTOR, and mTOR will stop autophagy. But you're probably still getting the fat burn benefits, the preservation of lean muscle in your population. One of the big reasons why I don't allow a protein deficient fast in my audience is because the quality of the protein they're taking is not pure 100% animal protein. It is oftentimes a vegetarian or plant-based protein. So we're looking at some incomplete amino acids. They're having to sort of diversify to get the whole amino acid profile. So, and because it's so hard to get enough protein on a vegetarian or plant-based diet because of the bulk and the fiber you get full, So I have to give them enough of an eating window to at least get 1.2 grams of protein per kilogram.
Got it.
And I'm not willing to compromise on that because most people coming into my program, they're already sarcopenic, they're already muscle wasted, they're very protein deficient. And because they're vegetarian and plant-based, they're not in ketosis in the eating window. They're starting from around 80 to 100 grams of carb a day. So they're not in ketosis.
Okay.
So so what I tell them is, let's make sure we do both windows well. In the eating window, we make sure protein is at target 1.2. And in the fasting window, we go long enough to get into ketosis through fasting.
Mm. Got it. Okay. That makes a lot of sense. One of my favorite moments about the conference was that Thursday, and I'm sitting next to my friend Robin, who's reversed her bipolar with a carnivore diet, as we're sitting and watching on stage Hannah Warren, who reversed her bipolar with a vegetarian diet. And I think more people need to know that there's lots of different options. And yes, we may have favorites, but there's lots of different ways to do this for many different people in different cultures and different cuisines. So I love that you explained that. I think that's super, super important and really insightful. I do want to talk about some of your content in your talk because again, it was so different and so helpful. You opened up your talk by talking about diabetes distress, which I think is really interesting and very underappreciated. How much stress there is around chronic diseases, and in particular diabetes. In particular, can you tell us what is diabetes distress?
Yes. So again, living with diabetes is a chronic thing. It's not, a fever of 2, 3 days or a back that you pull and it's done in 7 days. It's kind of with you for a life in a way. Even if you put it into remission, somehow it can be during its difficult phases overwhelming. And the idea of diabetes distress is that there are negative emotional experiences you can have. It's not depression. So everything else in your life would be going fine. You're not depressed, you're functioning fine. But when it comes to diabetes, you're low on confidence, you don't feel supported, you don't feel understood, you feel like a failure, you feel guilty, you feel like you don't have enough options or resources. And so the creators of this, the founders of the Behavioral Diabetes Institute, Dr. Polanski and Dr. Fisher, they created this scale for type 1 and type 2 diabetes. It's a measurable, reproducible, validated survey where you can actually ask the questionnaire and people can fill it out at home. These are online free tools for clinicians to use. And the patient can understand on a 1 to 6 scale, how big of a problem are these things? There are questions like, I don't feel like I have a doctor I can talk to. I don't feel like my friends and family understand how tough this is. I'm worried that no matter what I do, I'm finally eventually going to get complications of diabetes no matter what. I always feel like my food choices are like a failure. I'm paraphrasing. I don't have the exact words and each word matters, but these are the kind of effects is how bad is this? And the higher the score, 6 being it's a very big problem or biggest problem, and 1 being it's not a problem. The higher the score, this turns into higher HbA1c levels. This turns into more complications, more healthcare costs. And the good news is you can educate people, you can support people, you can bring the score down, and this is mapped to more self-care behaviors in eating and physical activity and movement, in taking medications, in checking your blood glucose, in showing up for doctor visits, and this turns into reduced HbA1c and reduced healthcare costs.
Mm. I remember you made the point in your talk about our recommendations for HbA1c, and it's like on the one hand, you do have like ideal levels that you really want to get somebody down to, but also you have people that have insane HbA1cs, and anything lower than that would be better, even though it's like way higher than ideal. It would still be a step in the right direction. So how do we manage those two kind of truths, and what has the evidence shown as far as like us making recommendations for where somebody's blood sugar target should be?
Yes, and that was always hard, right? Because some of those documents said if the person is more motivated, you can aim for a lower HbA1c. And if they are less motivated, you can aim for a higher HbA1c. And I was instantly uncomfortable when I read this paper because I was like, I didn't see a blood test for motivation. Like, how am I going to measure somebody's motivation? Is it on their face? Is it in their hairstyle or clothes? Or how do we know how motivated someone is? And that could fluctuate from day to day, depending on what kind of day you're having. And I get barely a few minutes with these people, and I'm going to make a decision based on that. for their whole health plan. So I just didn't feel qualified or confident that this is a good way of putting it. And, luckily, a few years later, that document got modified. It's still not perfect, but it's better than what it used to be, where now they say motivation levels of people are modifiable factors, which means you can make an intervention to change or influence somebody's level of motivation.
Okay. Well, that leads us to kind of something you talked about as well, which I've managed to stay married for over 7 years because I think I've understood this a little better. The fixing reflex. When
Yes.
somebody says they have an issue, my first instinct is to say, "Great, let me step in and fix the issue." Again, like my wife would come up with a problem and I'd want to step in, and it took a long time to like realize like she doesn't want you to step in. She just wants to express that she's got a problem. You don't have to go in and fix everything. Just listen and validate. Tell us about the reflex, the fixing reflex, and how many of us with like the kindest intent doesn't really end up helping people very much.
Exactly. And it's so innate that we went into the profession of being coaches and healthcare providers and, committed life partners and parents to help. We want to help. It's a strong desire to help. It's actually a beautiful thing that we want to help and we want to make a difference. It's just sometimes we do it in a way that ends up stepping on people's boundaries or invoking the exact opposite psychological reaction than what we were trying to do. So we're actually sabotaging our own efforts and we're not actually helping the person that we wanted to help. So going with the example you raised about the HbA1c, let's say somebody walks in with a high HbA1c and I see their carbohydrate intake is 250 plus and I want it to be less than 100 and I see their proteins are down. One way for me to talk to them, because I have 5 minutes on the clock, my degree's on the wall, so we know who's the expert here. It's me, right? I'm the smart person, and you've come here to get my advice. So I'm going to tell you is cut your carbs and eat more protein, take these medicines, bye. and and we just somehow think that this is actually going to change a whole person. Like you're going to actually achieve a full behavior change in a person in by doing that much. What eventually almost universally will happen is the minute you say that to someone, they're going to have to arch their spine and say, but wait, I have all these reasons why I need to be at this level. I need to be in the status quo. And it's because what you missed as the helper is this person took the appointment to come see you. They want to get better. They don't want to be sick. They're not wanting to be at 250 carbs and protein deficiency and ill health. They don't want any of that. They just don't know or they haven't thought through. And this precious time with you might be the first chance that they've had in their hectic, crazy, busy life to come here and have some quiet time to think about diabetes for the first time in your presence. So they probably know, I'm probably eating in a way that's not helping my sugar, but I don't know what to do about it. I just haven't had time to think about it. It's overwhelming me. Or I probably know I should check my glucose more often or take my medications, but it doesn't happen. So they're already feeling that. And they also know that if they made these changes, they would get better. So there's like a seesaw, like there's opposite ends of what's happening inside their mind. And they've got this power struggle of me versus me. And you walk into the helper's office, the helper's like, oh, I'm here to fix you. I was born to fix people, and I'm going to tell you what you should do. And what I've done is, instead of this being an internal conflict of my ideas about status quo, my ideas about change, the helper has taken away the mic from me and is now talking about change. And well, if they're talking about change, all I have left to talk about is the status quo, because that side needs to be heard. Well, that backfires then, because now the helper is like, oh, this person's being stubborn. This person's not listening. This person's not interested. This person's not motivated. Oh, I'll give them less difficult or less intense HbA1c targets. Oops. That's very dangerous, because I pretty much created that reaction in the person by taking away their voice for change. So this is a coaching technique. This is a counseling or almost like it's actually, before it's coaching or counseling, it's a listening technique. It's listening first. Are you listening to their needs or desires or reasons for change? Are we even engaging with their agenda? What is it that matters to them? And can we take a walk with them and where would they like to go? And why would they like to go there? And is it okay if I offered some support or advice along the way? That's the fourth, I mean, it's not fixing them. We're taking permission. Would it be okay if I showed you how 250 grams of carb is affecting you versus the 80? But that's only once you've done the preparation of building that relationship where I see you, I respect you. I know you've got reasons for the status quo. I know you want to get better. So let's talk about what's going on.
Mm. That's so helpful. Your slides were incredible. I remember the seesaw kind of slides, and that was really helpful to kind of visualize, to understand this is just human nature. Like we could be talking about anything, any kind of communication works this way. And one slide in particular really stood out to me was you see people's really common not excuses, like issues, like the gym is too far away, I don't work out often enough, it's too difficult, it's uncomfortable, I don't like it. And you see the response from the fixer is commonly like, oh well, no pain no gain, or like, well, you really need to dedicate more time to doing this. And you see the problem and then the response, and I can already feel internally inside myself like there's already resistance. And yet it's so easy for us as fixers to say those things and take those stands when it doesn't help. It causes that kind of resistance pop up with people.
Yeah, for sure. And I really wanted to hold on to that particular slide. And I'm so glad it stuck with you, Casey, because that was what I was trying to show, because I knew that this topic means a lot to me and I've internalized it and it's my agenda to talk about it. But it wasn't even on anybody's radar until they heard about it that day. So for me to expect, same way that it's hallucination for me to think a patient's going to walk into my meeting and then just walk out fully transformed because of like 5 minutes of content from my mouth. Same way, it would be inappropriate for me to expect one talk and the whole audience is like just transformed, right? Permanently. It's not how it's going to work. So how do I break it down to meet them where they are as the audience, as the listeners, is I know this is a big shift from where you might be, but do you see why you might be interested in it? And do you see how, if I show you how it's possible within a 5-minute interaction with the patient saying exactly those same example sentences, I think I had 7 or 8 of those, 7 or 8 different sentences mapped where this part stayed exactly the same. The only thing that changed was your response. And how do you think the energy is going to shift so that it becomes visible to you? It becomes possible, tangible, maybe worth learning for your own skills because you've been there. You've been in the situation where you tried to fix somebody and you got resistance and it was draining, it was tiring, it was unpleasant, and you didn't feel like you made a difference. That's not what we're all getting for. We're trying to make a difference and help people. So maybe we were doing something to get in our own way. And I'm really glad that you saw that because the idea was to make it manageable bite size.
Well, I mean, that stood out to everybody. I don't know if you remember how many questions you got afterwards that were like, how do I apply this? Why is this not being taught where I am? How can we incorporate this? You got so many questions about that. So people were very, very interested. And one of the ways I think about this is one of our former guests, Dr. Corey Jenks, he's done improv, which you've kind of talked about in the past. And he's talked about how important it is in improv and in medicine and in fixing people to not squash conversations, but to say yes and yes and yes and I'm validating you. And like those combinations of words seem to be so important to validate people's responses and then help them come to the conclusions of whatever they want to do.
Exactly right. Is we don't want to be the one they're arguing with. And so going from yes, but energy to the yes, and that was the flip is if you change how you show up, instead of being in a yes, but with your client, you're probably going to have a yes, and that moves the conversation one sentence forward. This patient is more likely to want to come back because they felt respected, they felt validated, and they felt heard, like you were saying with your wife. Is that's what we need. And there is that intrinsic wisdom within everybody. There's the wisdom within the patient to thrive. I knew there was tons of wisdom within that room to want to be that better healthcare provider for their patients. And that's the spark that we saw when people were coming up to the mic. It was that spark is, oh my gosh, how can I do more? Let's take this to the next step. Let's go one step forward. I'm feeling some confidence that I want to go ahead instead of me showing up on the stage and insulting them. It's like, you guys don't know what to do. You guys are like hurting people and you're start trampling on their feet. I could have come with that accusatory fixing attitude towards my audience, right?
It would have gone a different direction for sure.
They
Interesting.
would have never called, no callbacks.
Yeah, exactly. Exactly. Okay, so speaking of that and motivational interviewing, I think some people are aware of the term. I'm certainly aware of the term. What are some other like key core tenets that us out there who are trying to help other people can incorporate when we're trying to have these conversations to really help people?
Yeah, I was lucky enough to just conclude a 10-week online training session that Dr. Bill Miller did for about 150 Indian healthcare providers online. He just
Wow.
finished it yesterday. Yeah. And, there were 10. I'm going to come up with as many as I can. The first one being accurate empathy. So that's accurate listening with empathy together. So again, listening first is, are you listening accurately? For example, if someone says, and this just happened, is one of our patients said, I've reached 18 hours of fasting. Should I do my blood tests now or should I do them later? And, one way of responding to this could be, oh, so you want to fast longer before the next meeting. And that was an assumption, but actually what the client meant was, I'm going to be doing blood tests. Sure. So should I do more 18-hour fasts and do some blood tests after a while and then come see you guys? So there was a bit of almost like an assumption being made that I'm assuming I've understood what the client is saying. And we might just go 2 steps ahead because we're on some different track. So are we really being present, emptying out the head and and listening to what's being said so you can really respond. So accurate empathy, genuineness, where you're showing up and maybe you don't know all the tools of motivational interviewing yet because there's a process, and Bill Miller himself says 40 years later he's still learning and making mistakes and making himself better. So it's like anything, is you can keep building your expertise. But if you're doing it with a genuineness, is I really want to be as present as possible for this person because I believe that there's an expert sitting in them. They know what's going on in their life, and they are going to be the ones changing behavior. Healthcare used to be about writing antibiotics and doing surgeries on burst appendix and broken bones, where all we had to do was go fix it. When the fixing is all about behavior change that the client has to do when they leave your room, the helper is not doing that. It's the patient doing that. So we need to realize that all of healthcare is not the same. And in chronic disease, in metabolic health, in preventive health that we do, longevity, it's about knowing that that person wants to thrive, deeply believing that. And instead of coming at them with the fixing reflex, it's more about, I know that you can succeed and I know that you have the tools to do this. I'm going to help you so that we can find your strengths and tools to do this together. That's kind of the mindset and the heart set. It's like a mindset and heart set of motivational interviewing. And there's many others, but these would
Sure.
be some of the core ones.
Yeah, I really love that. And that reminds me of something that really stood out in your presentation as well. When you said these conversations involve 2 experts. And yes, you might have read the books, you may have digested the content and got the papers and the certifications and the degrees or whatever. You might be an expert and you might know something, but you're talking to an expert and this person is an expert in their own life. That really stood out to me. I thought that was really important to say.
Yeah, and that's motivational interviewing right there. It's a partnership. And we can, at the most, be like a guide. It's not us leading them and dragging them towards being better people or better human beings. And it's not us following them around where we know that they're going to head towards worse outcomes. It's about almost like a GPS navigation system is, I'm going to navigate you. You could still go that way. You might face more traffic there, but if you go there, I'll navigate you from there. But I know that this is the faster, safer way, and I'm going to keep showing you that and guiding you. But ultimately, it's your choice.
Yeah, I see. Okay. So going back to what we referenced earlier, where we have the fixer, they're hearing reasons why people can't do certain things. You're hearing the typical fixer responses, which is like, suck it up, go do this, make time for this, you have to do this. You had another slide later on where you contrasted that in this way that we could have kinder responses. So what could be some examples of better responses that a fixer could say when somebody says like, oh, I can't do this. This is too difficult for me. I can't work out. It hurts, whatever. Like any kind of, way that somebody's saying they can't do something. What are some kinder responses we could come up with?
Right. So you have the option of affirmations, you have the option of reflections. So I'll give you some examples. And this is an example that is relatable in the Indian context, and I'll come up with probably something maybe you might see as well. I mean, let's go with, okay, so the gym is too far. I can't go because the gym is too far. If it was closer, I would go. So, okay, so you would like to exercise more often than you do right now. Instead of, well, you're only going to have 24 hours in the day, so what's your bright idea? Versus, versus, okay, so you do know and you do wish that you could exercise more regularly because you know it's going to help you get fit and you want to get fit. So you're flipping it. It's very hard to argue with that.
Yeah.
Right. You're saying yes, or it hurts when I exercise. Oh, so in spite of pain, you have tried to exercise because you know exercise is good for you and you tried even though it was hurting. That's how you know it hurts.
Mm.
Okay, so I'm seeing the expert. I'm not seeing them as this crazy, broken, defective, lazy person. I'm saying, I see you and I see your efforts. Or maybe they quit smoking, but now it's sugar that they're dealing with. You've already overcome one, habit because you're so interested in your health. Quitting smoking is not easy, and you've already achieved that. That's a strength you have.
It's so powerful. It's such a powerful flip. Yeah. You
That's
gave an
powerful.
example. Again, you just unlocked this, but you gave an example. I believe it was a guy who is wanting to improve his health and drop his carbohydrates, but it was family, I believe, that was like making food for him. And
Exactly.
what was he going to do if somebody's bringing him food out of kindness and because they loved him and they wanted to show that through cuisine? Like that's another really great real world example that probably a lot of us have to deal with.
Yes, so his wife had died and his kids lived, his son lived a couple of distance away. The son and the working wife were sending food to dad's house and it was carbohydrate heavy. And he was like, I can't say no. I can't tell them to change this or that it's not good enough. I don't want to hurt their feelings. I was like, okay, so the relationship and the help that they give you, you have gratitude for that. You have gratitude. They're trying to help you and you have gratitude. Let's first honor the relationship. It's so sacred to him. He's willing to eat something that is bad for his health because he's so thankful for the help he's getting from his child. And, to rewind and sort of to fast forward, what happened in that conversation was he realized I know my son is doing this because he loves me. I know he doesn't want me to be sick. He doesn't realize what this is doing to my glucose. I'm going to talk to him. That's what happened, but that came from him, not from me.
Yeah, so that was going to be my next question is how often do you find when you respond in that way, when you just say, wow, that's amazing that you are, accepting help from your family. That must be so gratifying for you and how grateful you must be for your family. You're responding in that kind of direction. How often do you not even need to bring up a suggestion after that, that the client, the patient is the one that then once they hear that, they're coming up with their own solutions and they have great ideas themselves. Does that happen more often than not?
Oh yeah, the best ideas come from them because they know things about their life that I don't. For example, another lady, it just happened, I think yesterday. Again, Indian homes are sometimes multi-generational and large size under one roof, one kitchen. So here's a person who is married into a vegetarian household where the one cook, and again, in India, we have the luxury of having help where somebody's actually coming into the house. We have active kitchens, a lot of home cooked food being served every day across the country. And so you've hired somebody to come in and cook. So they had one person whose professional job was to cook, but it was for 9 people. She was the ninth person in order of priority for what gets cooked for her versus majority opinion, carbohydrate heavy meals. And so her thing was, well, I can't ask the cook to make more things for me because it's already too hard on them. And I work and I don't get home until after long hours at the office. And so I just eat what's made because I'm so hungry. Now, I said I actually flipped it, and sometimes you can do an exaggerated reflection. So within reflections, there are different levels of reflection, and depending on how much rapport and trust and respect you have with the client, you can take a bit of a risk. And so I said, okay, so you want to make sure that your relative's health is or food choices are taken care of. So you're honoring the health or not health choices. You're honoring the food choices of 8 people out of 9 in the house. She was like, yeah. And I was like, and your health comes last. I said that to her. And she was like, yeah. And then she was like, but what can I do? So suddenly now she's kicking that label off. And she was like, what can I do? My maid, my help, my cook, she cooks 2 eggs for me in the morning. And so I was like, okay, is it okay? Now I use my degree on the wall. Would it be okay if I offered some input here? Did you know that it's okay to eat more than 2 eggs in a day? There's really no link that ever proved that eating more eggs ever caused any heart disease. So would eating more eggs be an option for you? And I gave her the example of sometimes I eat 8 or 10 eggs a day. If I needed to get the protein, I didn't get anything else. And she was like, I can do that. So this is where she's activated. She's ready to receive something. That's the partnership. Is I don't make her have to find all the answers herself. It's okay to then step in and say, I do have some expertise with working with this. Here's where I educate you. There's a knowledge gap about whether eating more eggs is okay. She thought you have to throw the yolks out, cholesterol. She had those old ideas in her mind. So that was where I saw the opportunity to increase her knowledge.
It's just, again, like, to have that knowledge, to read the studies, to understand the facts, and again, use your degree, like you said, like use my nutrition certification, like that's all really good. But to even access that, this is where the coaching side of things is so important. And this is why your talk stood out amongst all the other talks at that conference, is because you can't even get to the point to use your knowledge or wisdom unless you're opening that door for somebody and letting them come to those conclusions. That was a wonderful example. I really love that.
I'm so glad. I was wondering how much to bore you with something, an excerpt from my practice, but that just brings it to life. Is what how do you do this? And I will say, Casey, that I have the luxury. I have created a bubble for myself where I don't have a healthcare system, a hospital, a boss, an insurance provider, or some corporation beating down on my door, expecting me to see like patients every 6 minutes. Okay. I have the luxury, I've created and designed it that way, where each interaction with the client and my team is a 15 plus 15-minute experience, 15 minutes with my coach, and then a 15 minutes with me. So that counts as one appointment. A 30-minute bundle is one interaction with me. And then they'll have a 30-minute interaction with the coach, and then another 15 plus 15 where I come in the second 15. I've designed it that way. They get chat support. So I've had to break out of the tradition. It's very difficult to visualize doing this in a very hectic clinic or in a busy ambulatory office where all the existing machinery, it stays the same. It's very hard to fight that. And I had to exit out of the traditional system, get out of that hospital model. And I was created in the hospital. Doctors are born and raised in the hospital. That's where we learn from. But it didn't work for what I was trying to do as outpatient preventive. I wanted to prevent people getting into the hospital.
Yeah, yeah, got it. Well, let's see if I do this right. But it's amazing that you have so much time with patients. And when you did your presentation, you presented it to people in a 5-minute window and made it accessible for everybody. So I really appreciate that. Even though you have lots of time with your patients, you recognize not a lot of people do. And your presentation made this type of questioning accessible for all of us, regardless of how much time we have with people. So again, I think that really landed with the audience and was very, very important for people to learn.
Well, Casey, you just made me feel heard and seen and validated.
Mm. Well, you deserve it. Yeah, I just, again, it really stood out and was very, very important. I just want to ask you briefly about your book, Turnaround Diabetes. What were some of the key components of your book that you wanted to really get out there?
Okay, so turnaround diabetes, it's got a lot of this behavioral element in there. It's not just a book that's going to tell you to reduce your carbs, sleep well, don't take stress, exercise often, and fast. Those, I just said it. That could be a 5-sentence book. Done. Why is the book that thick? It is meant to be your bedside reference manual for every problem that you might encounter in making those changes in your nutrition, in your sleep, in your stress management, exercise, and fasting. I have done all the troubleshooting that has been done in like the conversations you and I had today, that I've had over more than a decade of being obsessed with empowering people to learn, or me understanding their knowledge gaps, breaking those knowledge gaps down into bite-sized pieces so that if you reduce your carbs and you get sugar cravings, what do you do? What are some causes of hunger all day long? And I've listed them out. Here are the causes of why you might be feeling hungry as you do this, and what are the solutions for each? What are some problems you might face when you try to exercise? What are the solutions for each? What are problems with fasting? What are the solutions for each? So you shouldn't get stuck. There's really no way for you to get stuck beyond this book, except if you want to actually talk to somebody. But the book should have a lot in there for anybody who wants to have better diabetes experiences with less medication. And people have already started telling me that although you've mentioned that this book is for diabetes, there's so much in there, about 80%, that's for people who want to have a healthy lifestyle.
Yeah, it's so fabulous. You did such a good job writing that book, and I was so grateful to have met you at the conference. I'm glad your highlight from the conference was meeting people. I agree. And you think about like, you know, a 2 hour flight for me. It was so terrible. Like you had to fly halfway around the planet to be there, but all of us are there. We're on our own dime. Doug is not paying you to do your presentation. We're staying there. We're missing out on clients and patients and business that we would have had. And we're sacrificing a weekend in San Diego to spend all of our time inside in a conference center to learn from each other. But that's how important and amazing this work is, and to be around other people who have these common interests and really want to help people out there is just, it's so powerful. So I'm really glad that that was like your main highlight from that conference as well.
Oh yeah, it's funny, the analogy of catching the flight, but after the conference, I felt like I was flying. I felt so uplifted,
Yeah.
so supported, and just seen, where smart people who I respect were seeing me and saying, yes, the work you do matters. I mean, it's a bit, it takes a lot of grit to do this like by yourself, and to finally feel like you're not doing it alone. And yes, I shouldn't discount the fact that it's rising in India, but in the flesh, to see it received so abundantly and so resonatingly, it was nourishment for me, and I felt so supported.
Yep.
So honestly, I know I'm coming back next year.
Yeah, awesome. Well, it would be great to see you. Every year, Doug offers a bit of a discount if you sign up for next year's conference that day. That's an easy swipe of the credit card, and we'll be back
Yeah.
next year. And like, can't wait to see everybody again. And you're right, like the energy that you carry on from that. I've also argued the point that like whatever cost, whatever time, all of whatever you sacrifice to make it to some of these conferences, you will not miss any of it. It will repay you back 1,000%. It's totally worth it. And meeting you and finding your content was so valuable and important, not just for myself, but many of the attendees there. It was really special. And we just so much appreciate your presence there and your presentation, which just really made such an impact. And again, think about the ripples that that will make into how all of us who have genuine desires to help people can rethink how we're presenting the message of the people that we want to help. It's so important. So much appreciate you and your content and taking the time to be on our show today. Very much past what would be my bedtime in India, where you are. But where would you like people to go to find you and connect with you and your work?
Oh, sure. So we have a website. It's Reisan Health. So that's REISAAN health.com. And my name, it's Roshani Sanghani. I'm on Instagram. I'm on LinkedIn with that name. So
Gotcha. And it said Roshani, not Roshani.
right, the A is silent. It's just there to confuse people. So
Yeah, gotcha. Roshani Sanghani. That's great. That's a beautiful name. And yeah, it was such an amazing presentation. And I'm so grateful that you would come on the show and help educate the rest of us again, that have genuine desires to help people. Your work is really special, and I really appreciated the message. So thank you so very much for taking the time to not only come to that conference and make that presentation, but to also be on our show today. We really appreciate you.
thank you, Casey. I appreciate you taking the time.
Oh, absolutely. It was a pleasure. And this has been another episode of Boundless Body Radio.